I'm Dr. Michael Staudt, and I'm a functional neurosurgeon with Michigan Head and Spine Institute. I was born in Windsor, Ontario, and grew up in Canada. I spent a lot of time in Michigan with my family and spent some time in Ann Arbor studying with my wife. I want to bring my skills here to Southeast Michigan in functional neurosurgery as it's a specialty that could benefit this area as a whole. I performed my medical and residency training in neurosurgery at the University of Western Ontario in London, Ontario, Canada. I then performed 2 fellowships in functional neurosurgery in the United States. My first fellowship was at Case Western Reserve University in Cleveland, Ohio. My second fellowship was at Albany Medical Center in Albany, New York. I specialize in functional neurosurgery procedures. That includes the treatment of chronic pain. Chronic pain can take many forms, and I specialize in the treatment of things known as failed back surgery syndrome, post-laminectomy syndrome, and neuropathic pain, which can include back pain, leg pain, arm pain, and pain due to diabetic neuropathy. I also specialize in the treatment of craniofacial pain. That's a broad definition that includes things like trigeminal neuralgia, occipital neuralgia, glossopharyngeal neuralgia, and atypical facial pain. I also treat movement disorders, including Parkinson's disease, essential tremor, and dystonia, with a specialized treatment known as deep brain stimulation, or DBS. I also specialize in the treatment of epilepsy. That can include specialized open brain procedures to remove a part of the brain that is causing seizures. In addition, I can also implant neuromodulation devices such as vagal nerve stimulators, responsive neurostimulators, and deep brain stimulators to treat epilepsy. I also specialize in the treatment of complex brain tumors and degenerative spine disorders, including cervical myelopathy and lumbar radiculopathy. The conditions that I treat are complex and often debilitating. They require a thorough evaluation that puts the patient at the center of the care plan. If you are suffering from any of these conditions, then I invite you to call the office and we can have a comprehensive discussion of management plans that can include both operative and non-operative management.